The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, My Bariatric Solutions features their mobile lap band unit to help patients with their follow-up lap band appointments. Craniofacial and plastic surgeon Dr. David Jenikov talks about his approach to facial rejuvenation with his patients. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors, and with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site, or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
After a workout, don't eat carbohydrates for at least an hour. Your body will be forced to break down body fat rather than use the food that you have ingested.
When we started trying to have another baby, weren't successful with that on our own the old-fashioned way, so we started thinking about other options. And so at that time, I was starting to get a little bit older. Our daughter was getting older. We didn't want too big of an age gap, so we went to see Dr. Kaufman.
Age does impact on chance of getting pregnant, and that's kind of our primary thing, and what we do here is try to size things up with respect to what are your chances of getting pregnant. And the first thing I always look at is age. I try to be kind of sensitive to it. And there is an age-related decline in getting pregnant, even starting in the early 20s, because the deal is women are born with about 1 to 2 million eggs. When they start having periods, they're down to 400,000, and then menopause, you got 0. So what happens, each year women lose about 10,000 eggs a year.
When we first started off with Dr. Kaufman, he recommended, the least invasive procedure. We tried that a couple of times and realized that we needed to move on, kind of break out the big guns, and so we did go forward with IVF.
At what age is it getting more difficult? I'd say 37, 38 is it is getting more and more difficult. 40, more difficult, and even at 42, much more difficult. there are always options. So if somebody says, hey, listen, I want a baby, most of the time, patients can have babies. They really can. It just depends on what they're willing to do and what they want to do and what their expectations are.
Dr. Kaufman was really good about explaining that just because one cycle doesn't work, a subsequent cycle isn't necessarily going to go the same way. You could have very different IVF cycles. When we did go through again, it's been about a year and a half ago, we did have a very different cycle and did result in a pregnancy, and in fact our baby girl was born last November. He was so warm and friendly with both my husband and me and our oldest daughter. And I have to say, his wife Lisa, that also works with him, is such a great source of encouragement and such a great resource of information and support for me as well.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Find your doctor on bestdocsnetwork.com.
And we are excited to have in the Best Docs Network studio Dr. David Genachove. He is the owner and director of the Genachove Plastic Surgery Group, one of the best plastic surgeons in the state of Texas, and operates right here in the Dallas-Fort Worth area. Dr. Genachove, welcome to the program.
Thank you, Jim.
All right, let's get right to it. If I come into your place, anyone else come into your place, they want to look younger. There's no doubt about it. So if you're consulting with an individual and they come in and say, hey, I want cosmetic facial plastic surgery, what do you do?
Well, anybody that comes to the office is really kind of unhappy with something about themselves. And usually when they come in with an issue about their face, we get comments like, I now have my grandmother's neck, or, you know, I look just like my dad, or I'm out there trying to get a job and I'm competing with people that are 20 years younger than me and I look 30 years older than them. How do I get back to a more competitive position? And so we start to talk to them. I talk to them about what their goals are. And so sometimes they think they just want surgery, when in actuality they don't really need surgery at all. They could use some non-surgical treatments with injections or fillers, or even some skin therapy. And those kinds of things will highlight some of the patients just enough so it'll get them where they need to go. Additionally, if they do need surgery, we do a full physical examination and really try to find out what it is that is bothering them. And so it's that detailed conversation with the patient at the very beginning that helps guide what kind of treatment that they're going to get.
Okay, now for an individual that comes into your practice and says, I just want to look better, what do you tell them?
Well, I have them look in the mirror. And that's where it all starts. We put them in front of a mirror and say, what is it that you see that you'd like to change? And so we address the eyes and the nose, the area around the mouth, and the jowl and the neck, and we look at each one of those, and then I begin to kind of move things around for them and show them what it looks like, what the options can be.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Sandra has a question for Dr. Ali Shakuri. How soon can my child be tested for allergies?
It's never too soon to be tested for allergies. The important thing is to be tested properly and only when indicated. So, for example, we should never have testing for allergies as sort of identifying something that your kid could be allergic to before intake. In other words, if your child doesn't have allergies to foods and eats these foods, you shouldn't have allergy testing to any of those foods. In fact, if 30% of the population may have a positive skin allergy test or blood test to foods which they consume and they develop no allergy symptoms to. One of the issues that we deal with allergists all the time is patients that are tested via the blood for food allergies. And then the parents needlessly avoid introducing those foods in the diet or removing those particular foods from the diet when they don't really need to. And so you test when someone has a reaction, or the important thing is to do the right test.
Shingles is a bad infection. It is very painful. When you have chickenpox, that chickenpox virus ends up living in your spinal cord nerves. Later in life, when your immune system is weakened by some infection or just fatigue and overwork, the virus comes out along the nerve or around either your chest or your leg or your low back and causes painful blisters that have fluid in them. Now, if you have shingles, you can't give someone else shingles, but the fluid in those shingles blisters has the chickenpox virus in it, your chickenpox virus. If someone hasn't had chickenpox, they're susceptible to chickenpox from that virus in the blisters of your shingles. So you should stay away from people who have not had chickenpox or people who are on chemotherapy or have an immune system that doesn't work well, because they can really get a bad case of chickenpox from your shingles blisters. Now, you can prevent shingles by getting a shingles vaccine. Very expensive, but approved and usually covered by insurances at age 60.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, I have good news and I have bad news. And he says, well, the bad news is both of your hips are in really bad shape. He says, you're gonna have to have the bilateral hip replacement. The good news is, I can do it, and I'm happy to do it. Dr. Tolson also had a model of the hip, and he said, this is what the procedure's gonna look like. And he talked through the whole thing, and he says, you're gonna be a new person once you have these hips in.
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Tolson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
Coming up on the second half of today's show, vein specialist Dr. Peter Morgan talks about the benefits of using the Clarivane procedure to treat venous insufficiency. Learn more about the Texas Heart Institute and their doctors with interventional cardiologist Dr. Annie Varghese. Cosmetic dentist Dr. Guy Lewis talks about his philosophy and approach to practicing dentistry. as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Clarivain is a new procedure. It's been out maybe for a year or so. It is a procedure that is associated with less pain, both during the procedure and post-procedure. Patients that have venous insufficiency that don't have it corrected are going to get worse. The question is, how fast will it get worse and how bad will it ultimately get? And that's dependent on the individual, how much of their problem is hereditary or genetic and how much is occupational. The typical presenting signs and symptoms, which include pain, swelling, restless legs, enlarged refluxing vessels. If you have the venous insufficiency corrected, the disease progress will completely stop, and if it recurs, it can be easily treated without significant intervention. When you use a laser or radio frequency ablation to close veins, it's an energy source that produces heat. And so you're essentially burning the veins using radio frequency or laser. And in order to control that pain, you have to put a tumescent solution, which is a numbing medicine mixed with normal saline, around the vein all the way up the leg. And so that requires several needle sticks, which is uncomfortable, and then that makes the leg kind of full, maybe a little tight, and there's some leakage of the fluid. And with the Clarivain, that tumescence not needed because Clarivain basically has a mechanical agitator, like a skip rope, that spins inside the vein and traumatizes the lining of the vein, and then we inject a sclerosant solution that augments the effect of the skip rope. When you use an energy source, there's always a risk that you could damage a structure that's adjacent to or near to the vein, such as a nerve or maybe even muscle, that sort of thing. And so with Clarivain, since there's no laser, there's no radio frequency, you're not using a heat source, and so it's, I think, significantly safer. All of the procedures are very safe statistically. The number of complications is very minimal, but I think there is some benefit with the Clarivain with respect to complications.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
For dry skin, incorporate more avocados into your diet. They're rich in monounsaturated fat and vitamin E, both of which promote healthy skin. Try them on salads and sandwiches, and even in smoothies.
Welcome. Today we're here with Dr. David Fish, who's the Director of Interventional Cardiology at the Texas Heart Institute. Dr. Fish, thank you so much for joining us today.
It's my pleasure.
So we know that you have done so many wonderful things in your career. Today we have just a few minutes to talk about one of your great interests is transcatheter aortic valve replacement. Could you tell the audience, what is that?
Well, for many patients, especially those reaching older age, often the aortic valve, which is the main outlet valve for the pumping chamber of the heart, becomes narrowed or stenotic because of degenerative changes of the valve. Ordinarily, this is a reason to do open heart surgery to surgically replace the valve. But in some cases, the risk for open heart surgery is very high for some patients. So for selected patients who have this problem and who are at high risk for surgical valve replacement, now we have techniques available and instruments available by which we can deliver a valve into the valve position through a catheter.
Wow, that sounds very amazing. For years, there was only surgical option for these patients. Is this happening in multiple centers?
Yes, they're widespread now in the United States. There is, as yet, only a single commercial valve available, and the delivery systems are large and require a lot of expertise and a great deal of teamwork in order to deliver successfully.
We know that the great thing about the Texas Heart Institute is that it's a huge team of cardiologists and surgeons and support services. So we know that you are one of the great teachers here at Texas Heart Institute. Tell me what you feel about educating these students over the years. What has been your main feeling about this?
Well, we're fortunate here to have had over the years very highly qualified, very gifted students of medicine and doctors who come for their postgraduate training in cardiology here. And among these, a number choose to go into interventional cardiology. That is, of course, the branch of cardiology involved with putting instruments in the body and opening arteries and correcting structural defects.
Connie has a question for Dr. Amy Wynn. What is a urogynecologist?
Urogynecology is a combination of urology and gynecology. So we specialize in seeing just females with pelvic floor disorders, anything below the belt. So that includes the bladder, any bladder conditions, urinary incontinence, pelvic organ prolapse, recurrent bladder infections, or even like recurrent vaginal infections. And the difference between seeing me versus a general gynecology really depends on your OBGYN and their training. A lot of OBGYNs now don't feel as comfortable treating women with urinary incontinence or prolapse because they didn't get a lot of that training during their residency, or they've got more complicated cases where they want to send it to a specialist like me.
Ask our doctors on bestdocsnetwork.com.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
Before bariatric surgery, I had multiple prescriptions for blood pressure, prescriptions for high cholesterol, prescriptions for many different things. I'd had a lap band for 10 years, and that had to be removed. So the procedures that Dr. Rodriguez recommended were either a gastric sleeve or a gastric bypass. I chose the gastric sleeve because it was an easier recovery. It seemed like a more natural alternative.
Whenever I have to do a revision in obesity surgery, what's happened is a patient hasn't had the result they wanted from the surgery, or they've developed a new set of medical problems that are obesity related, and it's necessary for me to come in and change their original operation. When patients come to me with obesity surgeries that haven't worked for them, I make sure to tell them that it's a medical condition that we're dealing with. And many times that medical condition needs different treatment options. And in today's world and technology of obesity surgery, we're very lucky to have a variety of options for different people.
I am doing absolutely wonderful today. I've had no problems with it. I had no pain after the surgery whatsoever. The main barrier has been a mental barrier to where you have to retrain your brain not to eat large quantities, and that will cause you to be quite uncomfortable. But other than that, I've had no side effects whatsoever.
Whenever I address patients who are having revision surgery, I bring them back to the basics. It's necessary to make sure that they're practicing good nutrition, daily aerobic exercise, and taking their vitamins. I help them make sure that they're on the right path to good health and, of course, losing a lot of weight.
I went in weighing 233 pounds, and as of today, I weigh about 180, and that's been 4 months ago. It has been an amazing thing. It feels very natural. It creates a feeling of fullness that's not strange feeling like the lap band was. Both mentally and physically, it's been health-wise wonderful, and I wish I could have done it a long time ago.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
The #1 place that germs live on your body is under your fingernails. So try to start digging your nails into a bar of soap when washing in order to reach those germs.
Watch more videos on bestdocsnetwork.com.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bed on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner, and so he's seeing people in the clinic, and so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile, and then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me, he's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.